Hey, it's Hospital Week on the John Fredericks Show and throughout Virginia. It's so cool. Hospital Week, May 8 to 14 in the Commonwealth. Now, Hospital Week's an opportunity for us to recognize and reflect on vital public health, community building, and economic contributions made by Virginia's local hospitals like mine, Chesapeake Regional, and all their health systems. Now, the theme of Hospital Week 2016 is Patients Come First. What a novel idea. Patients Come First, a reminder that caring people seeking medical attention is the center of everything hospitals and health systems do. Now, you can learn more by going to isupportvirginiahospitals.com. isupportvirginiahospitals.com, and it's important to get involved. And everybody knows where I stand on reforming the Certificate of Public Need. I don't believe that it should be done away with because there's not a free market system, right? Hospitals are critical, and I've been not in favor of that for some time. And every time somebody comes on in the General Assembly to debate me, I win. Right, Mike? I mean, it's not even close. It's kind of sad. I just beat them all. Now, joining us now, my good friend, E.W. Tibbs Jr. He is the president and CEO of Centra Health. And E.W., in Centra Health, which is in the Lynchburg area, he's also a member of the Virginia Hospital and Healthcare Association's Board of Directors. So he's a bigwig. Now, Centra is an award-winning health system recognized for patient satisfaction and medical excellence. Centra operates hospitals in the Burgh, Lynchburg, Bedford, and Farmville, where we're on 105.1 FM. I love Farmville. And their medical center in Gretna. EW, welcome back. Great to have you.
Good to be back, John. Thanks for having me.
It's always fun when you come on. You get me all fired up because you're so passionate, EW, about what you do. And I love people that have passion in their work. Now, as I said, it's Hospital Week, both in Virginia and across the plains. Many different entities and causes. They have days, they have weeks, and things like that for recognition. What distinguishes Hospital Week, EW?
You know, John, as you shared, our theme is Patients Come First, and there's a simple reason for that. It's just the essence of who we are and what we do, and caring for people seeking medical attention no matter the time or the day. It's our mission, and our hospitals and health systems celebrate broadly, and during Hospital Week, it's really a time for those organizations, our organizations, to recognize our caring and dedicated professional staff, and that includes clinicians, administration, support staff, volunteers, really all the people that make it possible to do the things that we do every day and serving our communities. And I can tell you from my personal experience that every staff member in our organization and across the Commonwealth and other health organizations, they're vital to serving our patients. And I've been blessed to have a background both clinically and from a business standpoint. I started my career in nursing, and now in administration. I've seen the operations really from both sides, and I can just tell you firsthand how indispensable our people are and how important they are to fulfilling a patient-centric mission.
Well, that is so critical, EW, without a doubt. And now my listeners know that I've been really focused on the issue of healthcare for some time now. The challenges are real, and they deserve attention, and they have to get resolved. But amid them, how do hospitals manage to keep serving public health needs in such a challenging economic climate?
Sure. It really comes back to that patients come first mentality. And as you know, our hospitals are open 24 hours a day, 7 days a week, 365 days a year, and they're always staffed with skilled, trained, and committed and compassionate professionals. And if you look across the Commonwealth, our health systems employ about 115,000 people, and John, that's 1 out of every 9 jobs in Virginia. They're in healthcare. It's 11% of the entire state workforce, and so our hospitals are the places where people facing health challenges that life presents come to for relief, and when they have unexpected needs or care needs that arise. And if you just reflect back this past winter when we were hit with winter storms, snowstorms, the hospitals are there. And I'll give you an example here at Centra in Central Virginia. We have incredible community support. We had a brigade of kind of local off-roaders, four-wheelers who worked and helped get our staff here so that we could take care of patients. And another way is how we demonstrate our community investment. We had the privilege of opening a new medical center in Gretna, Virginia, very rural community, very important community, and we were able to do that because of the folks there and their support and prior to opening that facility, these were individuals that would have to travel from a half an hour to an hour for basic health care, including emergency access. And as you know, minutes are precious. And so our health system, Centra and others, we're investing in state-of-the-art equipment to put the best tools in the hands of our compassionate clinicians so that they can take excellent care of patients. And we also partner around other things like Zika or Ebola with state agencies, public health agencies. And that's just a few examples. We could go on and on about how our organizations serve the patients and our communities.
EW, you're talking a little bit about some of the challenges that hospitals face in rural areas. I've tried on my show for a very long time to highlight the fact that hospitals in rural areas, like you've touched on, have economic challenges that hospitals in non-rural areas simply do not have. And I think these get overlooked. We've seen a hospital close in Southwest Virginia. The impact that has not only on being able to get people to the hospital quickly, like you said, some are an hour and a half away, especially if you have a head trauma, but then the economic impact in the community. So I know this is Hospital Week. What are we doing to address the hospitals in rural areas, some of their economic needs? We just had another hospital close just outside of Augusta, Georgia. Mm-hmm. So, and if you look over the United States, I mean, it's a growing trend. How do we deal with this?
Sure. So the hospitals are major providers for public health and the economy, and that's especially true in the rural communities. If you look across the Commonwealth, last year Virginia hospitals had about 3.6 million emergency department visits, delivered over 62,000 babies, and admitted about 800,000 people to the hospital. And if you look at that time frame in 2014, Virginia hospitals provided about $2.8 billion in community support, and that includes things like free health screenings, clinics, health education, and other community-sustaining efforts. And it also includes some large figures, for instance, $584 million in financial assistance to patients for 1 year, and a $330 million supplement for Medicaid shortfalls that were absorbed by our hospitals and treating patients. And to make that really important locally, if you look at Centra, we employ over 7,000 people in high-paying, good-paying, well-benefited jobs in Central and Southern Virginia. And if you just look at 2015, we provided, as our organization, over $58 million in charity care. And so, like many of the hospitals in the Commonwealth, Centra is a not-for-profit health system. We treat all comers. It's part of our mission. We treat those with insurance and governmental programs and those that can't afford to pay anything. And that's really part of our patients come first approach to our community. And as you know, providing that level of service, it can be challenging, especially at a time when federal funding cuts they're rapidly rising, and the charity care, as I shared, is very significant. If you look just over the last 5 years, there's over 60 hospitals in the country that have closed, and there's others that are just in trouble. They're in danger. And amid all that, if you look at Virginia hospitals, Virginia rural hospitals, there are about 70,500 jobs in those rural hospitals, and they support at least 2 local economy jobs for each of those jobs when you look at the downstream impact. So hospitals are among the top employers in rural communities statewide. Hospitals are in the top 5 employers in 44% of the counties and cities in Virginia. So there's a direct and clear link between strong healthcare networks and community health and prosperity, and it's important we take all steps necessary to strengthen both.
No question, EW. And, in this day, when there's so much information, social media and everything swirling around, trying to compete for our attention, how do you cut through the clutter and to educate people about what we're talking about right now, which is the importance of hospitals, and remind them of everything that hospitals do? I mean, how do you get that message out?
Sure. So John, it's through forums just like what you're doing here, and we appreciate you so much. And it's also by continuing public and community conversations that we're engaged in every day. So it's grassroots, and the dialogue involves complex topics such as inadequate reimbursements for Medicaid or Medicare, that they continue to pay the health systems and hospitals less than even direct actual cost of caring for patients, and the fact that on average the majority of patients who are in the hospital, in Virginia hospitals, are in these programs. So it involves informing the public about the fact that under federal law, hospitals must treat patients who come to the emergency room regardless of their ability to pay, meaning that essentially hospitals are required to provide free and discounted care to folks, which cause a financial strain. It really just goes back to what you described. Healthcare is not a free market, and it involves sharing our stories with the public, and so many positive, really just heartwarming stories. They happen in the hospitals every day, and we have the pleasure and privilege of improving the quality of life for our patients. And I just can't tell you how satisfying it is to see patients' lives improve through the care that we're blessed to provide to them. And it just really animates the whole idea and theme of patients come first.
I tell you what, EW, as I've said before, we love having you on because you're so passionate about what you do, and I'm sure you impact so many of your patients and your employees by the attitude that you bring every day. Hospital Week is kind of an exciting thing for us because I'm a big believer in recognizing what hospitals do, and so it's on our radar screen. How do people get involved in Hospital Week activities and learn more about Virginia hospitals? Because like I said earlier, you only really think about your hospital when you have a need, as we have had in my family over the last 6 months or so. Other than that, you don't really think about them.
That's right.
So you want them there when you need them, but then when you don't need them, you don't think about them. So it's kind of a dichotomy. How do people get involved?
Sure. So they can visit isupportvirginiahospitals.com. That they can learn more information about hospital issues. And for Hospital Week, there's a lot of videos and interactive content on the social media there that can be accessed and shared through isupportvirginiahospitals.com. John, I would also share that engage with your hospital and health system outside of those times of crisis. Build relationships, understand the issues, and we're passionate not only about healthcare. We're passionate about ensuring that we contribute to a healthy environment and economy overall. And the way we really get to do that is through mutual dialogue, learning, respect, and really just driving for excellence. And we need our community to push us. We want to continue to strive to be better every day, regardless what our successes have been. And so I would just push for engagement, dialogue, conversations, emails, phone calls. You pick it. We'll meet our public and the folks that give us the gift of serving them every time.
I've only got about 2 more minutes. We're with E.W. Tibbs Jr. E.W. is the president and CEO of Centra Health. E.W., you mentioned a number earlier in our conversation. I just want you to highlight this a little bit. You said that $2.8 billion of hospitals is spent in supporting communities.
That's right.
I mean, that's a huge number. Can you just elaborate on that a little bit?
Sure. So when you look at Virginia hospitals broadly, you have to think about not only the people you employ and the resources that they spend, whether it's buying houses or renting a place to live or buying gas or groceries, the downstream impact of all the things they provide. And think about the number of contractors, the people that we buy goods from so that we can provide excellent care and services and support. We all do our very best to do business locally. So we're able to boost the economy simply by buying the things that we need as much as we can competitively locally. And, that's a staggering number, $2.85 billion. Think about a world that wasn't there. It really kind of goes back to that the comment I made that each of our healthcare jobs in the community support 2 other jobs. So we're so deeply ingrained with the communities. If the local hospital, if the local health system is not healthy, if it's not sustaining, if it's not growing, the community becomes more than physically sick. It becomes sick from an economic and really just a vibrancy standpoint. And that's not the place that you can recruit high-level professionals and young people and really just continue to refresh your community. So it's a mission-critical component of what we do.
Absolutely. Hey, EW, you've been fabulous as always, and these are really important issues to each of us that really matter because at some point we're all going to need a hospital, like I said. Now, that website again is isupportvirginiahospitals.com. That's isupportvirginiahospitals.com. EW Tibbs, thanks for all you do every day to provide quality health care in Virginia, and thanks for being with us. And you're always inspiring to have on, sir. Come on anytime. Love having you on.
Thanks, John. We appreciate you.
All right. E.W. Tibbs, the president and CEO of Centra Health. And what a passionate guy. I love getting him on. He's inspiring. And think about your hospitals. Wherever you are, listening to me right now, don't take them for granted. This is Hospital Week. And I've taken my mom, Dolly, to our hospital probably 8 times in the last 6 months, and they're always there, and they're always open, and they always take such good care of my mom. So don't neglect our hospitals this hospital week.